Okay, so today I'm going to be doing a newborn assessment, and I'm going to make sure that you have good lighting, that there's a good temperature, it's not too cold for the baby, and you want to do this assessment after birth, prior to discharge, and every scheduled visit. So I'm going to start by assessing his head. I'm going to feel for the inferior fontanelle. I'm going to make sure it's soft and flat. And I'm going to check the posterior fontanelle, which is in the back of the baby's head. And make sure it's soft and flat as well. Everything feels good. Now I'm going to assess baby's face. Make sure that his eyes, ears, nose are all symmetrical. Baby looks good. I'm going to make sure that the tip of the eye lines up with the ear. Now I'm going to check for nose breathing, so I'm going to close one nostril and then do the same to the other. And the baby's breathing good. Now I'm going to check baby's lips. Make sure they're not cyanotic. And they're pink, so that's a good color. Make sure they're moist. I'm also gonna put my finger in baby's mouth to make sure that there's a soft palate and a hard palate. Make sure there's no holes inside baby's mouth. I'm also gonna make sure to check the sucking reflex. Make sure assess baby's gums. Make sure everything looks a good color. And if you find any teeth, you want to make sure you document and let the physician know. Next, I'm going to move on to the rooting reflex. And I'm just going to rub baby's cheek and make sure that baby's mouth goes towards my finger. Next, I'm going to assess baby's neck. There's no bruising, no scratches, skin looks good. He has a good range of motion. Make sure that the trachea is midline. Yeah. Now I'm going to check the clavicles, palpate them. Make sure that baby's not in any pain. Now I'm going to check the arms for range of motion. And I'm going to check baby's grasp reflex, make sure that baby can grab my fingers. And make sure that there's 5 fingers on each hand. And now I'm going to look at baby's chest. Look at the skin. And then you want to make sure that the nipples are symmetrical. So check for cap refill, and you check that in baby's sternum. And it was less than 3 seconds. Now I'm going to check the brachial pulse on baby's arm, on both of them. Make sure that they're symmetrical. Now I'm going to listen to the lungs and to the heart and bowel sounds. So make sure you listen to the respiratory rate for a whole minute. Now I'm going to check the apical pulse, which is left of the sternum. And you also check that for a full minute. Everything sounds good. And I assess the baby's bowel sounds as well. And then I'm going to look at baby's stomach shape, make sure that everything looks. Make sure the baby's doing diaphragmatic breathing. So that just means that they're breathing from the stomach. I'm going to assess baby's umbilical cord, make sure everything's clean. And then the baby's umbilical cord did fall off, so that looks good and dry. There's no redness. Now I'm going to assess the Mora reflex. So you pull baby's arms up, and then when you let go, the baby's arm should fly out and come back to the baby. So like this, which it did. Everything's good. And then I'm going to assess baby's genitalia and make sure there's no rash. Make sure you check baby's bottom as well. And everything looks good. Now you assess baby's legs and make sure they're symmetrical to the feet. So, and then you want to make sure that baby has a good grasp on his feet as well, and they'll curl their toes towards your finger. So assess the folds in the legs, make sure everything's equal. Now we're going to do a Barlow maneuver, which is you push the legs in, and this assesses to make sure that there is no hip dislocation. So, and then you also want to do an Otolani maneuver, which is you open the hips and make sure there's no dislocation as well in the hips. So then you're going to check for the femoral pulse, which is on the thigh. And you're going to do both of them. And make sure that they're symmetrical. Now, everything looks good here. Now you're going to flip baby over. So you're going to check the tone, make sure that their legs are tight, like baby's grasping your arm. And you're going to assess if baby can kind of lift his head at this point, which he can. And you're going to check baby's shoulders, make sure everything is symmetrical on baby. Assess his spine, make sure he doesn't have any scoliosis. You're gonna look at his bottom as well, make sure that they're even. The folds are even. And then now you can flip baby back over carefully. So, and then you also want to make sure that baby's diaper's dry and there's no rashes. And then just make sure baby's comfortable before you leave. Put his clothes back on. And that is all. Yeah, you could swaddle him back in his blanket. Just make sure he's happy for mom. Thank you.